Hi, I'm Susan Wilson, the author of Women and Children First, The Trailblazing Life of Susan Dimock, MD. We are standing in the building where Susan Dimock worked as the resident physician and chief surgeon back in 1872 to 1875. The building today is called the Z Building, or the Zach Sheff's Building. The New England Hospital for Women and Children existed from 1862 till 1969, at which point it no longer really worked to be a hospital, and so it was turned into a community health center. It became known at that point as the Dimock Community Health Center, and today as the Dimock Center. What's fabulous is the original hospital building is still here. I'm standing in it right now in one of the small chambers. And it's in the midst of a renovation, so it's still in use for the healthcare of people in the area. Now, the room we're in is very small. This would have been the nurse's room. One of the things that Susan did was she professionalized the first real nursing school in the United States. People had, in fact, been acting as nurses prior to that, but it was more like something where you would apprentice with someone else. There were no formal training programs, no degrees, certificates, ways of making sure that people were actually well trained. And when Susan came back, because she had studied in Europe, she had met Florence Nightingale, she had gone to the school where Florence Nightingale learned how to be a nurse, because medicine in general, nursing also, were far more advanced in Europe than they were in America. And she brought these ideas back, and within a month of starting here as the resident physician, she really professionalized this and actually met the person who became the first professional nurse in the United States under her tutelage, a woman named Linda Richards. So one of the things they had done in this building to make sure that nursing was primary was between each of the patient rooms, they would have a smaller room that would be the nurse's room. And here we are in the nurse's room. So we would have a cabinet where they would keep various medicals. At that time, this is long before germ theory, long before penicillin, even aspirin. So we're talking very often botanicals, beef teas, enemas, very simple, more naturalistic type healing agents. But the nurses would be here. Now, you'll notice that I'm wearing this. Would this stuff be kept here? No, because it didn't exist, okay? We're talking at a time, I already mentioned, before germ theory, and therefore the idea of like wearing, things like surgical masks that we're all very used to doing now, wearing surgical gloves, none of this existed, okay? Even the nurses didn't have uniforms at that time. They wore calico dresses and wore little slippers, but there was nothing formalized. One of the things that Susan brought back with her and taught her nurses is that air and light and brightness and cleanliness are important, but there were still plenty of doctors who weren't even washing their hands between dissecting a cadaver and delivering a baby. Okay, so there were lots of problems, including one of the rampant things that ran through hospitals all throughout Boston. Anyone who had mothers delivering babies was a thing called puerperal fever, puerperal fever, P-U-E-R-P-E-R-A-L, or childbirth fever. And again, it was because so many doctors didn't even wash or be clean. So anyway, Susan was one of the pioneers in making sure that things were clean as possible. But there were other problems. This hadn't been invented. Clerical gowns hadn't been invented, so you might have something, from the previous surgery still on you when you did the next surgery. The other thing that was interesting is that we're used to modern surgical instruments that are all steel, because these can be cleaned and sterilized at high temperatures, autoclaves and other ways of cleaning these things. But in Susan's day, the surgical instruments, many or most of them, had either wooden or rubber handles. So you couldn't even put them in boiling water to sterilize them. So the problems were many. Despite this, Susan and the New England Hospital for Women and Children had a very, very high rate of success, and far fewer women dying from complications and or getting puerperal fever than any other hospitals around.